It's been a busy year since the beginning of January 2019. The UK has actually experienced several viral disease outbreaks. And I think this puts under the spotlight the way that we go about the management of these outbreaks and really look to see whether we could or should be actually preventing them. As with any disease, you really need to understand the way that it behaves if you're going to have a hope of controlling it or indeed preventing it. But what's been evident with our experience over the past year or so is that the social factors that also go into disease control, and this afternoon's programme I think will go into that in much more detail, but that's been an interesting feature of this past year. So this presentation really is designed to synthesise some of the reflections that I've got on these and for you to consider those. I'll just highlight that for any organism, its raison d'etre is to get to the next generation. It's quite a simple strategy, really. But there are different strategies to achieve this. Chains of transmission. You're all becoming experts now about chains of transmission. One infectious person passing on their infection to the next and it going through that chain. But there are more eloquent ways of doing this, and coexistence with the host, ideally without any adverse reaction to either of them, is a way to go. And this can be achieved through a number of means. The carrier state, the clinically silent infection that you don't know is there, or the latent infection, when the animal is not in fact always infectious but can reactivate that infection. There's also another category where you rely on the non-equine reservoir and perhaps insect vectors as well, but I'm not going to touch on those because those are not relevant to the diseases that I'm going to talk about today. So in terms of chains of transmission, the three diseases that I'll touch on, flu, equine viral arteritis and equine herpes virus, all will transmit through chains of transmission, and we need to focus on that. The carrier state is very relevant to EVA, and the latent infection, the herpes virus, the cold sore equivalent of the horse, if you like, has this latency as a strategy to survive. So we need to think about blocking these chains of transmission. We've all been issued with hand gel today, all with that in mind. And that indeed will eliminate flu and EVA if it's applied properly, but it won't deal with EHV. By identifying the carriers of EVA, this is shed through the semen of subclinically infected carrier stallions. Again, we can get on top of EVA. In terms of latent infection with herpes virus, I think we have to accept that we can only manage these outbreaks. We're not going to eliminate this infection from our horse population, and I think that should be borne in mind when we're thinking about the risks of this disease and how we manage our horses. So equine influenza. The image that I've put up here wasn't available last year because this is on a platform that we've since introduced, and all of our data is going onto this. And this is an interactive platform where we can put in the date. So I've put in the date of last year's forum, and you can see that we were a little way into an outbreak here. We thought we were on the downward turn. You can see that there on the map, it's got a fairly wide distribution across England, not so much in Scotland or Wales. And if we hover over the county of Cheshire and I press the click, this is what we come up. We have more information about each outbreak. The 7th of February was important because that was the first day of a 6-day lockdown that the BHA put in place, and the details are there. So if we rejig things and we put the full year in, this is the picture of what actually happened after that. This is the full year. You can see that there on the right-hand side, we had this large second wave of equine influenza over the summer months. And this was not entirely unpredictable, given that that's when a lot of equine activity goes on and a lot of movement and mixing of animals. But because that second wave occurred, well, we must have somehow failed to raise awareness in order that we could prevent that. You know, we saw a downturn in March and April, but then it took off through May and particularly in June. But in our defence, I would say that we had been sending out warnings about the risk of the second wave. We had supplied advice, and very much at the cornerstone of that is the need for vaccination. So those simple messages were either missed or, I'm being rather controversial here, I think they were actually ignored in some places as well. And I put up that image there on the right-hand side. That was a posting off social media at the forum last year, and it's not a very healthy one. So vaccination and isolation messages, I think, had been missed. So what factors actually do we think now facilitated that outbreak in 2019? Bear in mind, it was probably the biggest outbreak this country had seen in getting on for 50 years. Well, unfortunately, we have a low national vaccine coverage. And if we compare that to the rest of Europe, which did have flu but didn't suffer it as much as we did, our vaccine coverage is not as good as it is elsewhere. Events, unfortunately, despite the warnings, were not requiring vaccination as a condition of entry. Some events more latterly, as we went into the peak in June and July, were closing their doors and not going ahead. And whilst that was unfortunate for those events, I would argue it was actually a positive step. Anything that prevents gathering and then dissemination of infectious and infected animals has got to be a good thing. There was really, I think, a lack of preventive measures relating to new arrivals, new purchasers, event returnees. We had numerous examples where animals coming in, sometimes from abroad, were seen as the index cases for this. The anti-vaccination rhetoric, as it always will when this is going on, certainly gained traction in social media. And I think there was some confusion and certainly questioning of the vaccine rules which were necessarily being argued for change. The 6-month booster interval that you are now hearing about is scientifically based. There's a very strong argument for why vaccinating slightly more frequently is good for herd health. And I'm afraid the BHA Veterinary Committee did strongly argue for the 6 months, but this was ignored by the board, and that was not helpful. The 9-month rule has not really helped with the messaging. So, moving on to equine viral arthritis. You may have missed this one, but this was important. This is a notifiable disease in the UK. It's an acute viral infection known as EVA. It's transmitted by both the respiratory and the venereal route. And the success of this infection is the fact that long-term carrier stallions are established during outbreaks. The first recorded outbreak in the UK was in 1993. Some years later, the EVA order followed, making this notifiable in stallions. And it's been within the HBLB codes of practice for a good number of years now. And in that code, those animals following the code will be annually screened pre-breeding. Artifact vaccination of stallions and inactivated vaccine is advocated. And the control measures outlined in that document of how to deal with an outbreak. So what happened in 2019? Well, it was confirmed, the infection was confirmed in 5 stallions on 3 premises. All of these, in accordance with the EVA order, were officially confirmed and reported by the UK's Chief Veterinary Officer to the OIE, so the world knew that we had these infections. Restrictions were placed on the stallions, and it's important to say that there was no clinical disease evident. These were subclinical infections that had been identified actually by adopting pre-breeding screening and then chasing up appropriate links. So we had 2 linked outbreaks, one in Dorset that was reported on the 4th of April, a second one in Devon. These 2 were epidemiologically linked and can be thought of as one unit. We also, in July, had a Shropshire case reported on 31st of July. This was much smaller, no link to either Dorset or Devon. This outbreak followed the HBLB codes. The stallion was promptly castrated, and this was dealt with appropriately, and I won't refer to this again. If you want more details, DEFRA have got reports on both of these incidents. So I'll return to the Dorset and the Devon premises because this is where the interest lies. The epidemiological investigation by DEFRA identified in these outbreaks that in fact the respiratory route, even though they were stallions, was the most likely source and means of spread that this disease or this infection was circulating. It was not a venereal transmission. The positive stallions were found to have attended some UK gatherings, some stallion shows in 2018. 3 of these were considered high risk because they were attended by horses coming from mainland Europe, and therefore this probably facilitated the conditions for respiratory spread. The Dorset premise did undertake voluntary testing following the codes of practice, but this was not adopted, unfortunately, on the Devon premise. What was revealing is when we looked at blood samples looking for evidence of antibodies that would say whether or not an animal had been exposed to the virus, we found that 2/3 of that population on the Dorset premise had in fact been likely to have been exposed. So this provided evidence that we probably had respiratory spread on the Dorset premise once these stallions had returned from the gathering. But that Dorset premise is now cleared. 1 animal under supervision or under authorization from the CVOs had been exported out of the country, and 2 have since been castrated. Unfortunately, restrictions still apply to the animal on the Devon premise, And in August, DEFRA took the steps, as they are allowed to do under the EVA order, to actually notify the name and the site of where this animal is. And this is a letter that was written by Graham Cook to the veterinary record in August last year. And that animal has been named, and the site of where he is held is published. So reflecting on this, I think the encouraging thing was that the codes of practice had been followed, and that facilitated the identification of these infections. I would commend DEFRA that they consulted frequently and closely with the industry stakeholders. We had regular teleconference meetings, and occasional expert group consultations were held as well. But what was revealed was, unfortunately, that there were certainly new challenges from this type of transmission, non-venereal transmission, for the control of this infection under the EVA order. And the problem, as I see it, is that the EVA order does not require the measures outlined in the Code of Practice to be adopted as part of its mandate. But we had evidence both in Shropshire and Dorset that where those measures were adopted, then we could get these premises cleared fairly quickly. DEFRA outbreak management review is underway, and we're waiting to hear from those, and the industry has indeed supplied quite a detailed feedback to DEFRA. But my commendation is that the powers under the EVA order need to extend those restrictions until testing excludes that we've got ongoing and therefore respiratory transmission on premises that are identified with positive EVA. So moving on to the third of the trilogy, if you like, this is more recent outbreak that we've been involved in. So on Tuesday, the 7th of January, we diagnosed an infection called EHV1 in a 13-year-old non-vaccinated mare. This mare had a range of signs, but included in that were some neurological signs. We had received samples from this animal, which we tested, and those came back positive both for virus and for evidence of antibody, and that really did firm up this diagnosis of neurological EHV1. This animal was housed in an American barn with about 30 others. At that point, alarm bells do start to slightly ring. And unbeknownst at the time, but it came evident fairly quickly, 3 other animals in this same barn also tested positive for virus the very same day. The premise was a livery yard and also a competition venue, and that just adds a level of complexity in terms of who may have been at risk from this infection. The image I'm putting up here is, for me, one of the most positive things that we could take from today. This was the premise essentially going public and announcing that they've got the disease. And this single act made the control of this infection so much easier. And I really do commend the owners and the premise for doing this. We also reported on the disease through our usual International Collating Centre type reports. We put a report out through our Telltale text alert system so people knew what was going on. So this is the premises concerned. As I've said, they went public, they locked down, they contacted all of the people that had attended events several weeks prior to this being diagnosed. We had added complication that there were 6 veterinary practices and multiple veterinary surgeons attending horses on this premises, and we soon became aware that 1 horse had actually been referred into a local equine hospital as well. Always good to understand what you're dealing with in terms of the site of where animals are situated. You see that we've got the American barn, but we've also got 4 other areas where animals are housed on this. And so we like to get a handle on what is going on quite quickly, and we did a range of testing. And what you're looking for here is where we've got colour, yellow or orange, that's evidence that we may have had virus circulating. Those 4 yards where we looked, we found very little. Let's contrast that now with the American barn. Lots of colour, lots of evidence that this virus had been circulating before we got to the case. By this stage, 3 animals had been euthanized, put down because of clinical neurological disease. And the 3 animals that I referred to being positive for virus are up there, low levels of antibody but virus positive. Could act as a source of ongoing infection. This schematic here just outlines the plan of the American barn. Each white box is where a horse is residing. If we overlay the serological, the antibody tests as we had them, you can see that we've got, again, that activity, but still some white blocks. When we came back 2 weeks later and retested and looked for evidence of ongoing infection, we actually found that we had 3 fatal cases, 6 other neurological cases, 9 animals that showed evidence of reasonably recent infection because they seroconverted, and every other animal had evidence that had been exposed. So this American barn ensured that every animal under it had got exposed to EHV1. But we were able to give the whole yard clearance by the end of January, some 3.5 weeks later. This virus had really burnt itself out in going through like this, and we had no evidence of ongoing problem in the other yards. So what positive came out of this? Well, we, working with the vets, identified 3 risk groups. The high-risk group, those were the 77 animals present on that premises. They were isolated, as I've indicated. They were subject to clearance testing. We were able to open up. We also had a medium risk group, and these were the animals that really we didn't know what the risk was, but they'd been onto the premises since within a few weeks of this being diagnosed. They were advised to be quarantined on their home premises. Precautionary testing was conducted. Very pleased to say we didn't have evidence of any ongoing infection there. And then this group, the low, or what I would call the baseline risk group, these are all the other horses in the locality elsewhere in the country. We weren't advocating any additional actions necessary here, but people needed to remember this is baseline. We're never zero risk with EHV. It's a latent infection. It can reappear at any time. You may be wondering what happened to the hospital referral. Well, pleased to say that probably was a case of EHV, probably wasn't infectious when it went to the hospital. The hospital took responsibility, they closed, and then they cleared their contacts before releasing those animals back to home premises. So again, it was done very well. And the final slide, really, before I get on to my acknowledgements, is that social media, for me, really for the first time, I guess, had a really positive contribution here. I was asked to join a WhatsApp group of the vets that were concerned with dealing with this outbreak, and that was a great platform for private conversations so that we could get our act together, advise on the disease management plan, ensure that the laboratory results were consistently interpreted and then conveyed to owners. And it allowed us to collate all of those results, which would be going out to individual vets, to collate them together, send them to all the vets with the messaging about that was, and including the final clearance that we were able to give on that last day of January. Finally, I just want to acknowledge I'm greatly supported by the thoroughbred industry, the HBLB, the TBA, the racehorse owners, and the ITBF, just to mention a few. And I think it would be really great if the rest of the industry could come behind and help support us as they do. They can't do it all on their own, and I think you all greatly benefit from what they support, particularly the Animal Health Trust. Thank you very much, Mr. Chairman.